Hello, my name is Lauren. I am a registered nurse at a local rehabilitation hospital, and I'm here today to deliver a persuasive speech on the need for more strict isolation policies and procedures. Rehabilitation hospitals around the country have a common theme and goal that emerges. The purpose of rehabilitation is to restore something back to its original state, per vocabulary.com. To do so, many hours of physical, occupational, and speech therapy are required. Part of the role of a rehabilitation nurse is to reinforce the exercises and techniques that are being taught to assist patients going home so they're able to function well in their everyday lives. With rehabilitation comes regaining mobility and becoming social and independent once again, even while in a hospital setting. However, with that being said, a rehabilitation setting is still a hospital, and numerous diseases and conditions are still present in the lives of all patients. Hospitals are in need of additional protocols and procedures regarding patients in isolation that should be strictly followed for the safety of all. The definition of isolation from dictionary.com involves a complete separation from others of a person suffering with a contagious or infectious disease, or to be quarantined. I believe this means that individuals placed in isolation because of infectious diseases, especially in a hospital setting, should remain separated from others. At my place of employment, our patients in isolation leave their rooms to go to the dining hall 3 times a day, and they are out of their rooms for at least 3 hours for 3 hours of therapy. The cafeteria staff, great as they are, do not always have the time in between patients to wipe down the surfaces and equipment used between patients, nor do they have a specific location or set of tables to place patients who are in isolation. This means that the patients in isolation can easily come in contact with individuals that have a lowered immune system and spread disease easily simply because they're all in the hospital. The therapy gym is slightly better. They do have a lot more time in between patients to be able to wipe down the equipment and prepare for the next patient. However, that is not always the case. If someone is running a little behind or time permitting, it can be a little more of a time crunch than that. I do see most therapists wiping down equipment between patients. However, patients in isolation are still participating in the main therapy gym that we have, alongside all individuals who can put the other patients at greater risk for disease. With the high risk of contamination that could be occurring, I believe more action should be taken place to reduce these risks. I would like to encourage my coworkers to be more aware of practices involving patients that are moving around the building with stricter isolation precautions. More emphasis needs to be placed not only on prevention, but how to properly cleanse different surfaces that have become infected. I hope that in the future there are more reminders in place to reduce some of the controllable risks involving transmission of infections. One of our most recent reminders is just actually a poster that's placed throughout the hospital. It just says, "Got bacteria, you might not know it." It's a friendly reminder just to encourage hand washing and proper hand washing techniques, keeping things clean for everybody. So again, simple things like signs and email reminders are a nice way to continue to remind the staff to have proper hand hygiene. The process of spreading MRSA that occurs with carriers of this infection is the same that occurs with direct contact with an active infection. The difference being, in the case of colonization, it is not apparent to either the carrier or the person becoming infected that anything is wrong. That statement was found in an article from MedTV just discussing the incubation periods for MRSA. And that fact is shocking because carriers of MRSA do not always know that they're spreading it. Likewise, the people who are becoming infected, again, don't always know that they're being infected. MRSA can take up to 10 days to show its side effects or show any signs that the individual has gotten the infection, and then it can take that much longer to treat the disease. MRSA is transmitted most frequently by direct skin-to-skin contact with shared items or surface items that have become infected. According to the CDC website, MRSA and C. diff spores can survive on some surfaces for hours, days, or even months, depending on several different factors. This is a startling fact as well, especially when patients with infections are allowed to roam around the hospital into all different areas and settings. Appropriate patient placement is a significant component of isolation precautions as well. A private room is important to prevent direct or indirect contact transmission when the source patient has poor hygienic habits, contaminates the environment, or cannot be expected to assist in maintaining proper infection control, all just in place to limit the transmission of microorganisms, such as the high risk that can happen in a hospital setting. With our hospital as set up as it is, we do all have single rooms for our patients. There are no double room or two patients in a room at our hospital. We are very fortunate to have the ability to place everybody into a separate room. However, again, our patients are being transported elsewhere throughout the hospital, so it can be somewhat of a challenge to keep some of the patients in their rooms and to prevent the disease that way. Also, our patients can be a little on the sicker side, or they are coming to a rehabilitation hospital to get better and be able to do things more independently. But the process to get them there does take time, and it can cause them to be in the hospital for longer amounts of time to be more susceptible to diseases. Immunocompromised patients vary in the susceptibility to infections depending on the severity and duration of immunosuppression. They generally are at increased risk for bacterial, fungal, parasitic, and viral infections simply by being in the hospital. As stated by the CDC, the use of standard precautions, which includes good hand washing and usually just gloves, for all patients using those practices, and transmission-based precautions that include the good hand washing, a gown, gloves, and even protective eyewear or masks where appropriate, help to prevent the spread of disease on the point of the staff members. These facts show that hospitals need more strict protocols for cleansing rooms and surfaces, especially between patient contact, like our dining room tables and our therapy equipment. Also with the equipment that the nursing staff has with rolling computers and blood pressure machines and things. Just a higher emphasis on the proper cleansing and the proper chemicals or wipes that are used between each patient. There should also be more emphasis used, again, on the proper use of equipment, like the gloves, gowns, and when to don them and how to properly take them off as well, along with very specific hand washing protocols and techniques. In conclusion, a higher risk of contamination occurs at rehabilitation hospitals simply because our patients are not in their rooms as often and they're traveling throughout our hospitals, which provides everybody with a higher risk of transmission of diseases. There should be a greater enforcement with the use of protective equipment for all staff members and for those visiting the patients in isolation precautions. The lack of strict isolation precautions or practice is putting every individual at risk. The diseases that can be found in a hospital are dangerous to the immunocompromised patients and their family members. The nurses and doctors are also at high risk because they're the individuals who are going in and out of the patient's rooms most often, and they're having the most contact with the individuals that are in these diseases, or that have these diseases. My hope, though, is that all hospitals, including my place of employment, take to heart the need for improvement in the area of isolation and that new protocols and procedures are enforced and put in place. Thank you.